talk really loud tonight. I'm gonna play your favorite song. Don't you worry, Chance.
What the hell, great.
You'll love it. Usually Russ comes on here and tells me, "Oh, we're live."
We are?
Yeah.
Nice.
Okay.
Sweet.
All right.
Let's do
We
it.
are live. Let's do this.
All right. Waiting for everybody to hop on. Hop on and say, what's up?
So last night the chat on your end wasn't working. Only I could see it.
Let's
So,
see. Hey.
yeah, so the chat is going. Do you see the chat?
Yeah.
Okay. All right. Funny.
Well, just don't let me in it.
We'll let you in it tonight.
All right. Give everybody, I know it's right at 7:01, and we're going to go live and do some stuff. I'm the MC for tonight. Oh, this is terrible.
Sorry, guys.
This is what you get. Oh, I'm kidding. No, this will be fun stuff. What's up?
Russ says
hey,
hi.
Everybody. All right. So what we're going to do is we're going to roll through this. My name is Chance. I am one of the nurse educators here at nursing.com. I went a little retro with the shirt tonight, a little throwback. The tables have turned a little bit. So tonight, you guys are in for a special treat and talk. So Tammy, who is our the mother of nursing, if you will, she's the one. Great.
Thank you, Chance.
She's, I don't know. I mean, just shrink the screen. No, so Tammy is your go-to on social for just being, one of the most amazing, supportive people to be there to help you kind of in that first step. Hey, I need some help, and kind of in the social media, so Facebook, Instagram, all that stuff. But we're going to switch it up a little bit tonight. So a little bit of history before we get into everything. So Tammy worked at Dallas Children's Hospital for about 5 years before she moved to Salt Lake. And she was a surgery. Help me out. I want to make sure I say.
Yeah.
Pediatric
orthopedic surgical tech, if you want to be all fancy.
fancy words. So after so she got her degree, and then she went to Salt Lake to go work at a children's primary hospital there for about a year, and then she returned to Dallas and started working at nursing.com, and she's a community manager here. Little fun fact about Tammy: she enjoys running, and she likes to do Ironman distance triathlons. I used to be a runner, but I would never compete against her because she would blow me out of the water. There's no way that I could be able to. I might be able to take you in 100, maybe.
Oh, you definitely got me in 100 for sure.
Oh, man, I can't do anything. But one of the things that we wanted to do was we wanted to switch it up, keep a little, fun tonight. And Tammy's going to be here to help you guys understand kind of the nuances of surgical nursing, like kind of in a pre-op, peri-op setting, if you will. But what we wanted to do is, give her the opportunity to share her experience and to encourage you guys to go. I know that we're still in the midst of a pandemic, so career choices are always open, and we want to make sure that you guys have so much. So much of the great information out there, and there's nothing like going into an experience. I remember whenever I was about to go into the surgical ICU residency that I was in, I was terrified. I had no idea. It was like, holy crap, what is this? And talking to people in that experience gave me a lot of insight. So, Tammy's here to share that experience. And so I'm going to turn it over to her. And all right, well, you guys get strapped in, and she's going to take you on. All right.
Thank you, Chance.
You're welcome.
Thank you. Let me just hide you. All right, guys. As Chance said, I am the community manager. I worked in the operating room for many, many years. And so I just want to bring you some of my experiences. I have lots of stories, so hope you guys enjoy some stories. So let me just kind of dive in here. and just start here. Go ahead and keep coming in with your questions, and I will answer them towards the end as best I can. So let's just begin. So I always knew that I wanted to work in the medical field. From a time I was a little kid, I would watch hours and hours of Rescue 911, literally hours. Like if you talk to my family, you'll know. So I knew from a very young age that I wanted to do something in the medical field. After taking my prereqs, I found the perfect program, and it was called surgical technology. I thought to myself, yes, finally. The very next day, I scheduled an interview with the dean of the college, and I went in there gung-ho, ready to get going. And I came away from that meeting with the dean feeling very discouraged, very upset, because she told me that with my grades, I would never get into the program or any program for that matter. So let's fast forward about 3 years or so. I graduated from that very program, cum laude, on the dean's list, and then also on the president's list. My very first job out of school was at Dallas Children's. It's the number 8th largest pediatric hospital in the country. So I've been there. I've felt the struggles of not feeling like you're good enough. And I know that you can get through it and really chase after your dreams. Now you may be thinking, what can a surgical technologist teach me about being a surgical nurse? So as I was preparing for this talk, I was thinking, and I've scrubbed about 8,000 cases from a tonsillectomy to a heart transplant. I've been called in at 2 a.m. for an 8-9 hour bilateral femur fracture. I know what it takes to be a good OR nurse. I've seen it. I've worked with them. And tonight I'm going to teach you about the different stages of surgery. You're going to walk away understanding what makes a good operating nurse, and also how to stay calm and confident in stressful situation. So let's go ahead and start real quick with the different stages of surgery. So the different stages of surgery, you're going to have pre-op, you're going to have post-op, and so, excuse me, you're going to have pre-op, intra-op, and post-op. And all three of those are going to make up what's called the perioperative services. So let's go ahead and start with pre-op. So before you go and get your patient, you want to gather your supplies. So what does that mean? So with each surgery, you're going to have different equipment, different supplies that you'll need. So for instance, a tonsillectomy is going to have different equipment than, say, a femur fracture. So you want to make sure that you have the appropriate equipment that the doctor is going to need. You also want to make sure that your scrub tech and anesthesiologist have what they need. So it's like a team effort. So you're going to be working with all of the different people in that room to make sure that they have what they need. So the anesthesia provider, just like the surgeon, they're going to need different medications depending on the surgery as well as the child. So, or the patient. In my case, it was child. So sorry, guys, you're going to really hear me refer to these guys as kids. So my bad. So you're going to need different medications for that specific surgery. Once you go to the pharmacy and get those medications for the anesthesia provider, then if your scrub tech is ready, go ahead and initiate the first count. What does that mean? So you're going to count sponges, needles, all of that stuff. And then you're going to give the surgeon, the scrub tech, the medication. So if they need. So after you do that, you're going to go ahead and head over to pre-op. So pre-op, this is where you're going to pick up your patient and bring them back to the OR. So as soon as you guys pick your patient up, all of your attention should be on your patient and the anesthesia provider. I'm going to stress this so much to you guys tonight. You're going to leave walking away from this like, I got to stay with my patient. I got to stay with my anesthesia provider. So imagine this, guys. This is why I'm going to stress this so much. This really happened to me. So the anesthesia provider walked in with this little tiny 7-pound baby. He brings him up to the table, start intubating masking the patient down like they normally do to put them to sleep. Everything seemed to be going well. And then all of a sudden, out of nowhere, the patient starts to turn blue. But before the patient starts to turn blue, the nurse had walked out of the room to get the patient a blanket because, you know, the baby's cold and that's kind of what you do. And as soon as the nurse walked away, that's when the patients or the baby started to turn blue. So what had to happen, so in the OR, you have the anesthesia cart that's kind of to the side. So the bed's like right here. And then the anesthesia cart's here with the ambu bag where the nurse, or excuse me, the anesthesia provider will pump air or whatever. And then behind them is where they're going to have extra supplies. So you're going to have these oral airways, okay? So what the anesthesia provider needed to do was turn around, grab one of the oral airways to help keep the airway open. But every time the anesthesia provider would move, the baby would start to lose his airway and couldn't breathe. The nurse was in the other room. The patient was starting to turn blue, guys. So really think, what are the ABCs? Is cold the C? No. So once the patient is intubated, then go and get the blanket to keep the baby warm or patient warm. So now, once the patient is intubated, the surgeon will come in. When the surgeon comes in, he's going to position the patient how he wants him for that particular surgery. As soon as he does that, the surgeon is going to go out to the scrub sink and he is going to scrub his hands. During this time, the nurse will prep the patient. So the prep is dependent on the surgeon and really on the case. So once the surgeon comes back in, then the surgery will begin. So the scrub tech will gown and glove the surgeon. And during this time, the nurse's job is to chart on the patient. They're going to be opening sterile supplies that weren't necessarily open during the pre-op or that phase of the surgery. So you can still open sterile supplies during intra-op. So now during the procedure, the surgical nurse needs to always be aware of what's going on during the case. Okay, so here's another story for you guys. During a hemodialysis catheter removal on my patient, should be a simple, easy case, but you know, not every case is the same. Things come up, okay? So it was the hemodialysis catheter was being real stubborn, so it wouldn't come out. The surgeon gives it a little tug. Now the tug was a little too much because I look up, and if you see, I don't know if you guys can see my mouse or anything, but if you see right here, the patient's head is like right here. The operative field is here, and the anesthesia provider's here. So I look up over here by the drape, and I see the CRNA pull the drape down, and she goes, "What the hell did you just do?" So apparently when the surgeon tugged on the hemodialysis catheter removal, he tugged too hard and some kind of internal bleeding happened. Now, because the CRNA was paying attention to what was happening during the surgery, I was able to apply a sterile dressing, secure my back table, and then start CPR. Because of this, you know, the appropriate steps were taken to protect the patient surgical wound. So the last step is to count. So again, there's two things I'm going to stress the most, and it kind of goes hand in hand if you really think about it, is you're there for the patient and counting. So I'm going to tell you guys a story. Now this is totally true. It happens. And you know, take my experiences and use it if you decide to become an OR nurse or whatever. Okay, so during this case, I still remember it because it was, you know, anyways. So during this case, I believe it was a lobectomy. I can't remember exactly what it was, but the surgeon began to close. And as soon as they start to close, you initiate a count with your surgical nurse. So I said, hey, we're about to close. Can we do our first count? So we did our first count and it was off. Now, it's not necessarily uncommon for a surgical count to be off during a long procedure. So I tell the surgeon, I'm like, hey, our count is off. And he's like, okay, and just keeps closing. So the nurse digs through the trash. If you work in the OR, let me know if this has happened to you, digging through the trash, you're looking through drapes, seeing if it got put in something, you know? So we're looking, we don't see it. So we do another count. Again, we're missing a Raytech, I think it was, or a lap or something. So I say again, hey, our count is still off. And the surgeon goes, I know it's not in this wound, so find it, you know? So we count again. He closes, he puts the Dermabond on. Guys, I have some surgical supplies, but this is what Dermabond looks like. I don't know if y'all can see it, but it's like a glue that goes on the skin. I don't know if you know what it is, but so that's Dermabond. So he puts the Dermabond on. It's a type of dressing, and he leaves the room. He breaks scrub and leaves the room. So at our hospital, it was protocol. If your count is off, you have to get an x-ray. So we call the x-ray tech down. She comes down, we take a picture, and sure enough, the scrub is tucked right underneath. I believe it was the left, I don't know, lung. I can't remember exactly what side or whatever it was. It's right under there. Like, I just want you guys to think, like, what if we had woke that patient up, gone up to the floor, the surgeon said it wasn't in the wound, he was the one that was in there looking. Now, if you guys, pediatrics, the babies are small, so the incision's only like that big. So really it's just the surgeon's eyes and then his I don't know, PA or whatever, whoever's helping him, their eyes are the ones that are in there. They said it wasn't there. So, thank goodness we did that count. We stuck to the protocol. We stuck to our training and we did that, or else that patient would be upstairs with the Raytech inside of them. So I know this is kind of like extreme, but you guys, it does happen. Like I never thought it would happen to me, but thank goodness me and my nurse were, on top of it, and we kind of got the x-ray and helped the baby. So that is that. So moving on now. So after the surgery is over, now what you're going to do is you're going to take time to take your patient back to post-op. So you will go back up to the field. Now at this time, the field is no longer sterile. So you can be up there with the anesthesia provider and you're going to help them extubate the patient. Remember to always be, that patient is your responsibility, right? So help the anesthesia provider extubate the patient, then call and give a report on your patient. And then you're going to be taking them to a designated recovery area. So this can be different depending on the anesthesia provider as well as the surgeon. So your patient could go to ICU, they could go to the floor, they could go to PACU. So there's many different places that they can go. And again, it's dependent on those providers. Then you're going to take the patient up. You're going to call a report from the OR, give the nurse that you're handing the patient off to the like drugs used, all of that stuff. So it's going to be different. So I can't really tell you exactly what it's going to be, but it's dependent on your hospital and stuff. So you're going to take the patient up to the recovery, wherever it is, and then you're going to give a report again. Now, I want to jump into what I believe will make you. So I hope you guys don't have any questions. So we're going to jump on to a different area. So all of those are the different stages of the perioperative services: pre-op, intra-op, and post-op. So all three of those, again, make up the perioperative services. Guys, I love the OR. I loved working in the OR. I loved everything about the OR. And I'm so excited to talk about it. Anyways, side note, let's go on. All right, so moving on. What makes a successful nurse? Now, there's a ton of things that will make you a successful OR nurse. I pulled out a few that I felt were strong qualities, or whatever you want to say, that I enjoyed working with as a scrub tech. Teamwork, a willingness to listen, and patient-centered care. Like I said, there's many. I just pulled out a few. So let's just go on in there. So the first is teamwork. So teamwork, a willingness to listen to others around you. Okay. So everybody is there, and everybody is there for one reason, and that is the patient. So from the surgeon, from the anesthesia provider, the surgical nurse, the scrub tech, the X-ray tech. I'm pointing to this screen because that's where my slides are. But the X-ray tech, which is this girl, this is actually the C-arm that we used in the operating room. A C-arm is like an X-ray machine. It can be used for many different things, but we used it a lot in orthopedics. I am wearing a lead apron, I guess you can say. So that just protects you, all your areas, so you don't get, yeah. Anyways, moving on. So everybody in there is a team. So think about it. Without one of those people, the surgery won't be successful. So without the X-ray tech, you aren't going to get the pictures. Without the surgeon, you're not going to have the surgery. So treat everybody with kindness and respect, because everybody there is there for that one reason. I know at times it can be difficult. Everybody has bad days, but really try to stay, aware that everybody's there for that patient. Hold on. I just saw this. Okay. Yeah. First assist nurse role. Yeah. Let me just continue going through this. So step 2, be willing to listen to your team members. So the reason why I put this in there is because sometimes you can get really set in your ways. As a nurse, you've been doing this for so long. So this is the way that you do it. So really try to listen to what others have to say around you. Everything is evolving, so somebody might have a better way of doing things. And it doesn't mean that it's wrong, as long as it's still centered around patient-centered care and all that stuff, and it's not going against any of the JCO or whatever rules, policies. So be willing to listen to others and maybe take some criticism from them. So that is step 2. So step 3, you are there for the patient. Again, like I said, I am going to stress this point so much tonight in different ways, because I really think this is one of the biggest things to remember. Because if you remember this, you're going to follow all the other rules. You're going to do your counts. You're going to be by the anesthesia provider. You're going to pay attention to what's on that field because you're there for the patient. I know. I'm like, right. Okay. Anyways. So as soon as you pick the patient up from pre-op area, remember this, you guys. Be the voice when they do not have one. So just think about that for a second. They literally are putting their lives in your hands. So be the person that stands up for your patient. Think about it. If we were just to have accepted the fact that the surgeon had seen inside the wound and he said the sponge wasn't there, and we're like, okay, fine. That patient, there would have been so many more complications for that poor little baby. So be the voice when they do not have one. All right. So let's go ahead and move on. So this is how to stay calm and confident in stressful situations. So this, I feel, you can take with you throughout your entire life. I learned this very early on in my career, because working in the hospital, working with people in stressful situations, it can be hard. It can be really hard. But I want to share some of the things that I've learned, and maybe it will help you out throughout your career. So again, stay calm in stressful situations. All right. So let me tell you guys one more story, if that's okay. So this one actually, it really stands out to me because this was, fairly early on in my career. It happened about a year into it. And it really stuck with me. So let me just go ahead and go. So this was at Dallas Children's. I came in, it was Monday morning. I came into work and I came into the dressing room. You have to change into your scrubs. So I was changing into the scrubs and I got a call from the charge nurse. And the charge nurse says, "Hey, Tammy, please come to the front desk as soon as possible." So it's like, great, this is not what you want to hear on a Monday morning. So I get dressed real quick and I head up to the front desk where the charge nurse is. And I'm like, "Hey, what's up?" And she said, "Hey, Dr. So-and-so just posted a case up in the NICU and you're the free person today. So I need you to gather your supplies and head on up there as soon as possible." I was like, "Okay, all right. What is it?" And she's like, "Well, it's a central line. I don't really have much information, but she just said we need somebody right away." So I was like, "Okay." So what it means, I gather my supplies. What it means to gather your supplies is basically you're taking this, what's on the left, I believe for you guys, you're taking this room, which is a surgical suite, and you're turning this NICU room into your OR. So you have to take all of this equipment and turn this room into a sterile OR, right? So I gather everything real quickly and I head up to the 11th floor at Dallas Children's. So the elevator doors open, and I don't know if any of you guys have ever been involved in a code, but you know where they're happening because they are a shit ton of people. Excuse my language, but if you've been involved, right? So I was like, okay, breathe, try to breathe. So I take a deep breath. I head over to the NICU room door. Over here in the corner, I remember seeing the chaplain and the family and the social worker, and they're really trying to piece together why their I believe it was like a 2-3-month-old baby was healthy 2 days ago, but now is coding in the NICU at Dallas Children's. So I was like, okay. So I look into the room and I see about 20 nurses taking turns doing compressions on this tiny little baby. And then I see the surgeon. So I make my way over to the surgeon and I was like, "Hey, I'm Tammy, I'm down in the OR or whatever." Now I want to remind you guys that I was an orthopedic tech and this was a general case, and not only a general case, it was an emergent general case. So to say I was freaking out was an understatement. My heart was literally pounding out of my chest. I was terrified, right? So I go up to her. I was like, "Hey, what's up?" She goes, "Hey, they just pulled the line out of this baby and we need to put a central line in ASAP." It's like, okay, I've done hundreds of central lines, right? Actually, I have a central line right here. So let me just pause the story and show you guys what a central line looks like. So this is a central line. It can go, depending on where the surgeon wants it, but this is really tiny. So this one's like a one lumen central line. And a lot of times it comes out right here and it goes down, and it's a good place for to put medication in quickly. So here's all the stuff, here's the catheter to help feed the line in, and the needle that goes into get it in there. So anyways, that's the central line. So I was like, okay, so I open up real quickly and I go to gown and glow up the surgeon. We drape the surgeon out, we drape the patient out, and I hand the surgeon the knife. She makes the incision. And I brace myself because I don't know if you guys have done it, but I'm ready for that yell because that's kind of what happens. Like they're just high intensity, stressful situations. You're going to get that yell. So instead of her yelling, "Hemostat," trying to get my attention or whatever, she turns to me. She goes, "Hey, Tammy, can I have a hemostat, please?" Chaos turned calmness, guys. my heart quit racing. I was able to think clearly. Everything, all of my fears, all of my doubts went away. Because she was calm, I was able to be calm. So she taught me something that day. And I want to share this with you guys. So I learned from that day from her that if I was able to stay calm in those situations, I was able to think more clearly. And I've actually taken this with me throughout my entire life. Like in any situation, I feel like you can use these steps in order to stay calm and focused on what the actual task is. So since you can't always choose your surgeon or your professor or anything like that, here's some steps that I learned to kind of help me. So first of all, positive self-talk. Now, you guys may think I'm crazy, but this really helps me. So I want you guys to try this. So when you walk in and you see something that you're not familiar with or that you haven't done before, pause, take a moment and say, you can do this, whatever your name is. So I would say, you can do this, Tammy. That really helped me get into the moment and realize to myself that I can do this, So the second one is plan ahead, but be here in the now. So what does that mean? I know it's kind of contradicting a little bit, but I know in the OR, you're supposed to anticipate the surgeon needs. Like you're taught that all the time, anticipate. But while anticipating, stay in the now and think of the step that's next. So the surgeon is going to make the incision, and then you're going to need probably a hemostat or Bovie to kind of spread. So for a surgical nurse, you're going to bring the patient in, you're going to help intubate the patient, you're going to start the IV or get the blanket, just anticipate those needs, but stay in the moment. So you don't overthink it and like stress yourself out for the next few hours, right? And my third thing is ask. So there's probably going to be somebody that always knows more than you, right? So if you don't know something, go and ask a friend, ask somebody that works in there. Oh, thanks, Shannon. Shannon, sorry, distraction. Focus, Tammy. So ask somebody. So along with that, prepare. So prepare kind of goes along with ask. So if there was a case that I didn't necessarily know, that I would look, excuse me, I would look the day before. And if I was doing a case that I didn't necessarily know how to do, then I would prepare by looking at textbooks and again, asking a friend, what to expect, because there's probably somebody there that knows what to expect, right? And I really believe that, nobody's going to be, I've never had the experience where people are super angry and like, I'm not going to help you. No, I feel like everybody wants you to succeed if you have that team mentality. So those are kind of my 4 steps that I would do to help me stay calm and confident in those stressful situations. You guys can do this. I know I can't see you. I know I can't hear you, but as you're studying for your exams, as you're preparing for your quizzes, your assignments this semester, if you start to feel yourself get overwhelmed or feel like you aren't confident or whatever, pause, take a breath and say, I can do this, whatever your name is. Or I can do this, Donna, or I can do this, Mark. At nursing.com, I'm able to talk to you guys. I'm able to really know and understand what you guys are feeling and how you guys are feeling. And I want you guys to know that if you're feeling scared, if you're feeling overwhelmed, if you're feeling like you can't do this, you're not alone. You're not alone at all. There's so many people out there that are feeling those same feelings. Stick with it. Be confident because you guys can do this. I know you can. All of us at nursing.com knows you can, and we're here to help you guys. So we wanted to give back to you guys. I said this last night. So from now until September 25th, that's right, Emma, you can't do this. From now until I believe September 26th, we're going to be giving 25% off the Nursing Student Academy. In there, you're going to find tips and trick on test taking skills. You're going to have fundamentals. You're going to have help with med surg. Our educators were here to help. They've been where you are. They want to see you guys succeed. I'm going to, as I'm putting the link in the chat for you guys to go sign up for your $1 trial and give it a try for 25% off. While I do that, I am going to show you guys the giveaways, and we're going to kind of do the same thing. I'll come back and ask. You're welcome. I'll come back and answer your questions in a sec, but let me show you guys the giveaways here really quick. So tonight, I'm actually going to be giving away a nursing.com library. The library includes 6 of our books, so 140 must-know meds, nursing cheat sheets, lab values, nursing assessments, and nursing mnemonics. Did I already say that? I don't believe so. Anyways, and then the new nurse survival guide. So we're going to give away a library. We're going to give away, again, another scrub sheets, and also another NCLEX book, which I am sitting on because I'm too short and you can't see my head. But another NCLEX book, which if you guys were here last night, colorful, you have questions, you have rationales, all that good stuff in here. So we're going to be giving away those 3 things. So right now in the chat, I am going to hide me really quick, or hide this. So in the chat, I am going to put the link. So, okay, excuse me, forgot. So as I'm putting the link in there, if you guys put in an emoji after Anthony Smith, do it again, put in an emoji or some words. That's how you're going to get entered into the drawing or whatever. And I will pick at random 3 winners. So go ahead and do that. I'm going to pull the link for you guys to go and try your $1 no obligation trial for nursing.com. So I see you guys are coming in with your emojis. Keep them coming. Keep them coming. All right. So if you guys go to this website, you will get the 25% off, which is huge savings. Also, while you guys are doing that, I wanted to let you know that Brad Bass will be here tomorrow. He's going to be telling you how to grind for goals and giving you 3 steps for that. So don't miss tomorrow night. Again, we'll be having giveaways and all that good stuff. All right, keep them coming. While you guys are doing that, I have a fun video to show you. One of my professors showed me this a long time ago in school, and I loved it. So I hope you guys love this video. If you've seen it, keep them coming, keep them coming.
We praise the colorectal surgeon, misunderstood and much maligned, slaving away in the heart of darkness, working where the sun don't shine. Respect the colorectal surgeon, it's a calling few would crave. Lift up your hands and join us, let's all do the finger wave. When it comes to spreading joy, there are many techniques. Some spread joy to the world. I think the cardiologist is their best friend. But the colorectal surgeon knows he'll get you in the end. Why be a colorectal surgeon? It's one of those mysterious things. Is it because in that profession there are always openings? When I first met a colorectal surgeon, he did not quite understand. I said, hey, it's nice to meet you, but do you mind if we don't shake hands? He sailed right through medical school because he was a whiz, but he never thought of psychology when he read passages A doctor he wanted to be, for golf he loved to play. But this is not quite what he meant by 18 holes a day. Respect the colorectal surgeon here, and now we'll raise a glass for the rectal surgeon. Like the rectum can tell a liquid from a gas. We praise the colorectal surgeon, misunderstood and much maligned, slaving away in the heart of darkness, working where the sun don't shine.
Okay, Chance is going to kill me for playing that, but I hope you guys enjoyed. Okay. All right. You guys can stop putting in wash your hands. That's right. Wash your hands. All right. So let's go ahead and do these winners here. All right. So for the scrub sheets, okay. So to get your, if you win, to get your whatever prize, I guess you say, to get your prize, what you're going to need to do is email me at contact@nursing.com. Okay. Email me at contact@nursing.com and tell me what you won. And yeah. All right. So for the scrub sheets, let's see here. All right, TL Beauty, you win the scrub sheets. So don't forget to email me, contact@nursing.com. For the library, all right. Let me scroll up. Karen Sicaro, you are going to win the library. Email me, contact@nursing.com for the library. And now the NCLEX book. If Jennifer Bauer, Bauer, you are the winner of the NCLEX book. So again, tune in tomorrow night because we're going to have more giveaways. Yes, and Brad Bass will be here. Guys, go to nursing.com/YouTube live special to get your 25% off. Nursing.com. Thank you so much for joining us tonight. And I hope you guys had fun learning all about the OR and you will love it as much as I do. All right. Happy nursing, guys. Go out and be your best selves.